Thank you for tuning in to this recording of the rollout of the Neonatal Daily Classification to all planned maternity units in BC. The intended audience for this video are frontline healthcare providers caring for newborns and the clinical site champions for this work, who may choose to use this recorded presentation to assist in the rollout to your teams. This presentation should take approximately 17 minutes of your time. By the end of this presentation, the hope is that you have a sense of the purpose of this work and are familiar with how to use the Neonatal Daily Classification tool. The purpose of classifying a baby is threefold. First and foremost, it is about assessing the baby to determine what he or she needs. The second purpose for classifying a baby is to act as a communication tool between care providers to support clinical decision-making. This ultimately lends itself to the third purpose for classifying babies on a daily basis, which is to ensure the baby is in the right place and receiving the right resources based on his or her needs. The following are general guidelines around classifying babies. Classification is done on admission and once daily, including the day of discharge. It is important that staff classify babies at the same time daily to ensure it does not get missed and for accuracy in data collection. It is done on every baby, every day, regardless of where they are. It is also done on any baby up to 28 days of life which has been readmitted from home to a maternity, special care, or neonatal intensive care unit. The intention is to include pediatric units at a later date. The reason for the 28 days specified reflects the period of time in which a baby is considered a neonate and aligns with the scope of the provincial perinatal data registry. Once admitted, daily classification is then recorded daily until discharge. Therefore, if a baby is readmitted at 5 days of life and happens to remain in hospital until he or she is 36 days of life, for example, that baby should continue to be classified even though he or she is past the 28 days because readmission occurred prior to 28 days. Classification would not be performed if the baby has been readmitted from home past 28 days of life. When classifying a baby, the level assigned reflects the highest classification assessed for the baby in the past 24 hours. Therefore, when determining the classification, assess the baby at that current moment in time and in the past 24 hours leading up to that moment. It is appropriate then, in so doing, that occasionally an infant will be assessed and classified higher than the services and resources available at that site. In other words, it is possible and acceptable that a baby could be classified as a 1B in a site that does not normally care for babies with those needs. This is important to know, as it is what informs the planning process. In some areas of the province, we know anecdotally that this can be a regular occurrence given the geography or location of the respective site. However, without having the data as validation, it can be a challenge to make any necessary recommendations. Now that we have reviewed the general guidelines for classifying babies, I'd like to turn your attention to the tool itself. It has been used in the province's 13 NICUs for the last few years and will now be used in maternity units as well. Although it may appear slightly overwhelming and wordy at first glance, it is actually quite straightforward and easy to complete. This is what you will be using to assess and classify the baby, although this is not where you will chart. The form you will be entering the classification on is the Newborn Clinical Path or the Neonatal Daily Classification Monthly Record. The Newborn Clinical Path has been updated to include an area to record the classification. As of May 28, 2014, any site that ordered refills of the form from the form's order warehouse would automatically have received these updated paths. Most sites have opted to make the switch directly from the outdated forms to the updated ones, with only a few deciding to use up their existing stock before switching to the new ones. At this stage, most units have likely already started using the new ones with or without even realizing it. For those who have not, due to having a large stockpile of the older forms, you can use the monthly record in the interim. This is a copy of the Neonatal Daily Classification monthly record. It is the form that the 13 NICUs across the province use to physically record the classification. You would only use this form at your site if either you're using up your old stock of newborn clinical paths, or if you do not use the newborn clinical paths for charting on babies requiring readmission under 28 days. As indicated earlier, the tool should be fairly straightforward, which we hope to demonstrate over the next few slides as we work through a few cases. Let's consider a baby that is born at 38 weeks, 3 days gestation by C-section, weighing 2,975 grams and breastfeeding. Let's break it down to determine what level this baby would be classified as. What level would the gestational age be considered? What about the weight? How would you classify a baby that is breastfeeding? And finally, what about the fact that this baby was born by C-section? To assign a final classification to this baby, you would look at all the variables marked, and the highest variable checked would be the overall classification for that baby. In this case, the baby would be considered a normal level 1A. When charting on the newborn clinical path in this particular instance, you would document the time and enter a check mark or write 1A under the N for norms column. Had this been any higher a classification, it would be explicitly written under the variance column. For anyone using the monthly record form, the time would be documented and the classification would be reflected by putting a check mark or X in the appropriate column for a specific day. In this particular example, the baby was admitted on May 7th. Therefore, the sheet would be labeled for the month of May, and the classification on the 7th would be filled in on the day accordingly. Let's consider another example. Assume a baby was born at 32 weeks, 2 days gestation, and is now 5 days old. The baby weighs 1,580 grams, is on caffeine for apnea of prematurity, receiving TPN, and is feeding every 2 hours via nasogastric tube. This baby is under double phototherapy. How would this baby be classified? Let's break it down. What level would the gestational age be considered? What about the weight? How would you classify a baby that's on caffeine? What level would TPN be considered? How about the NG tube feeds? And finally, what about the fact that this baby is under double phototherapy? Overall, what would you classify this baby as? If you look at all the variables, parental nutrition ranks the highest. Therefore, this baby would be considered a 2B, and that is what would be reflected on the newborn clinical path or monthly record. Although you may never have such a case for so long on your units, it was selected as an example to demonstrate how one variable can bump up the classification assigned to the baby. So where are we at today? This is now being rolled out to all sites with planned maternity services across BC in the hopes that at a more local level, this classification can help facilitate appropriate planning, and that once the data has been collected and reported by our health records colleagues, we will be able to use the information to plan services on a more provincial level. The implementation of this work has been split into phases to make the rollout to the province more manageable. Going forward, there are a few things sites can expect. The first thing site champions can expect is to see a process evaluation and a request for a chart review. In order to assess any gaps in implementation and make the process stronger, site champions will be asked to complete an evaluation and perform a chart review, providing a summary to Perinatal Services regarding completion of the classification. Site champions will be contacted in the weeks following the rollout to your respective sites to provide this feedback. Kindly complete and offer any suggestions you think will be helpful in making the process better and more user-friendly. The second thing sites can expect is electronic charting. Several health authorities have either moved to electronic charting or are moving in that direction. While those platforms may not be part of one provincial system, and Perinatal Services doesn't have all the answers, we do realize that it may and will in time affect how the classification is charted, but for the time being it will continue to be charted on the newborn clinical path or monthly record form. Finally, a longer-term overall goal of this work is for Perinatal Services to be able to work with your health information management counterparts to analyze the classifications that you have captured. Approximately 1 year post-implementation, the data that the health information management teams at your sites have collected should help to identify and recommend sites for Level 1 nurseries. While PSBC does not have the authority or funding to open nurseries, with quality data, we should be able to make recommendations to your respective health authorities based on where the biggest areas of need arise. Therefore, the work that you do to classify your babies on a daily basis will go a long way in serving the needs of your communities. As clinical site champions have received or will receive a toolkit to assist them in rolling this out to their teams, we will now review the contents of the toolkit. Enclosed in your toolkits, there will be hard copies of the following: Guide for completion of the Neonatal Daily Classification tool, laminated copies of the tool for every bedside chart, 2 to 3 posters to display in lounges or at nursing stations, a copy of some case examples, a copy of frequently asked questions, and a memo to circulate to all primary care providers to ensure that they are aware of the classification. The hope is that this will either stimulate further discussion about the process, lending itself to more collaboration among the physician and nursing staff in the care of these babies, or at the very least, to keep them in the loop in the event you go to them with a concern about the level of a baby on your unit. Several sites have chosen to engage their primary care providers in the rollout to their teams. How you choose to involve them is entirely up to you. The memo is meant to act as an additional support for you. In your toolkits, you will also notice a USB key with an electronic version of all the documents just reviewed. In addition, it will include a copy of this PowerPoint that can be used to present to the staff, as well as an electronic version of the monthly record to be printed for anyone who will require a supply for their units. This concludes the presentation of the rollout of the Neonatal Daily Classification. Please contact the project lead for this work, Anita Dirks, at adirks@phsa.ca with any questions. Thank you.